the background, the cost of illness studies or COI, we use this approach to estimate the disease burden, disease or illness. So COI approach or the cost of illness approach mainly classifies the economic consequences into three parts: direct, indirect, and intangible. So the intangible cost of a disease or a condition itself is clearly studied across the globe, and most studies have examined the variation of intangible cost components across income group from an individual perspective. With respect to the World Health Organization research priorities, that's why I took this topic, exploring the variation of IC components across income groups, because equity and inclusion, social determinants, and fill the evidence gap and the global relevance. So the identified gaps with respect to the intangible cost curve: no operationalized definition on intangible cost, and no disease-specific tool to measure intangible cost, arguments over quantification, and less attention given in COI studies, and no explorations on components of intangible cost across countries. So the objective was to describe the variation in individual perspective of IC components across countries specified by income level. The methods we adopted were: first, we used scoping review. So the guidelines we used were PRISMA extensions of scoping reviews. The electronic search was conducted in 6 databases: Web of Science, PubMed, Scopus, Econ Lit, Econ Papers, Ideas, and Econ Stock. The eligibility criteria, as mentioned here: the primary studies on intangible cost of a disease or a health condition and published in English language. The exclusion criteria were the health system perspective and the background articles and health programs and population level. So after title and abstract and full text screening, the data were extracted. So the main components of the scoping review was to identify the terms, tools, and methods. So for this study, we used the identification of the terms and definitions. So moving to the second step, extracted data on the IC terms or the intangible cost terms, we use inductive critic analysis. And the themes, then the categorization was classified according to the world and income classification. Moving to the result section. So as I mentioned, the scoping review is the identification of the studies via databases and identification of study via other methods. So already we could identify 76 studies for this scoping review. Distribution of selected studies based on the income classification. So you can see clearly the majority of the studies are from high income countries and less from the upper middle income countries, and there were no studies from the low income countries. So the main identified domains were physical, psychological, and social. When talking about a physical domain, so you can identify there are 3 main components, and under these 3 main components, there were 6 subcomponents. So when we go to the disease condition related, the majority are from high income and lower from upper middle income countries. And complications, the majority of the components were from high income countries. And management of the disease conditions or the treatment related, both are equally specified by high income and lower middle income. So overall physical domain is led by high income level, followed by low and upper middle income countries. The psychological domain consists of 6 main components: management, treatment, psychological symptoms, disease condition, psychological symptoms, psychobehavioral response, well-being of owner, social support group, psychological symptoms due to social factors, and psychological symptoms due to functional limitations or disabilities. So you can see the majority of the psychological domain components are led by high income countries and rest were from upper middle income countries. The social domain, the main component is social implications process. So it has these subcomponents you can see, and in the social domain, the social support network, personal behavior and coping skills are dominated by lower middle income countries. So move to the conclusion and recommendation. The majority of reported literature on intangible cost originate from high income countries, and you can see there were no studies from the low income countries. And achieving a comprehensive global understanding of intangible cost components require further research from low income countries for the balanced representations among the components as well as the different income groups. And exploring intangible cost constructs across income levels can reduce disparities, improve policy relevance, and guide a standardized global network, because there are no any tool to measure intangible cost. So we have to identify these disparities across the income groups. My main collaborators, so you can this study was funded by NIHR. And thank you very much.
Great. Thank you so much, Ms. Valerie, for that very nice presentation.